Okay, whenever you're ready.
Okay. Hi, everyone. Thank you for having me. I am Dr. Leslie Sanders. I am actually in Maryland, and I'm happy to be joining you guys here on this discussion on COVID-19 trauma and how do we help our children. Next slide.
Hey, trying to do three things here.
So I am a mother of two. I'm a licensed clinical psychologist in Washington, D.C. and Silver Spring, Maryland. I am certified in integrative medicine for brain health. So what that means is that, my way of understanding and treating brain health conditions like anxiety, depression, ADHD, autism is by way of working with the body and finding the root cause and the source and helping the patients connect the mind-body connection. Also, I am trained in conducting psychological evaluations, clinical and developmental and neuropsychological evaluations as well, just to name a few. To assist me today, I also have two of my phenomenal colleagues, Dr. Amelia Hall and Dr. Brandon Davis. And so, Dr. Hall, can you please introduce yourself?
Sure. Good afternoon or good evening, everyone. I'm Dr. Amelia Hall. I hold a bachelor's degree in psychology, a master's degree in counseling psychology, a second master's in clinical psychology, and a doctorate in clinical psychology. Just to give a brief background, my experience really spans the fields of medicine, public health, and psychology. I have a lot of experience with children and families, but I work also with diversity, multicultural issues, emotional and behavioral challenges, with a big focus on trauma and complex trauma specifically. I do a lot of work with regard to forensics. So I work a lot with children who have been sexually traumatized or traumatized in a lot of other ways. Also children and families going through separation and divorce, and also specialization in psychological evaluations.
Okay. Dr. Davis?
Good evening. I'm Dr. Brandon Davis. I'm a psychologist. I've worked in the practice with Dr. Sanders and Dr. Hall.
You want me to go with you?
My background is in psychology. Also have a background in special education. So I'm coming from perspective as well from a clinical perspective, but also I'm coming from perspective of being a special educator within the classroom setting. Pretty similar to Dr. Hall, I do have a background in trauma, specifically research on post-traumatic growth. And I am delighted to be here and answer any questions that may come up.
So thank you. And so Dr. Davis and Dr. Hall will, if there's any questions that come up, we'll also watch out for the chat as I'm going through the presentation. I have quite a bit here. I know we have an hour, so we're going to rock and roll. And don't hesitate if you have any questions. Next slide, please. So trauma, what is trauma? Trauma is an emotional response to a terrible event like an accident, rape, or a natural disaster. Immediately after the event, shock and denial are typical. Next slide. And some of the longer term reactions to trauma may include, but are not limited to, unpredictable emotions, flashbacks, strained relationships, and physical symptoms or somatic symptoms like headaches and stomach aches. Next slide. So we talked about like just a basic understanding and definition of trauma. Now there's something that's called ACE, which is the adverse childhood experiences. And it's important to understand that as we're working with our students and our clients to get a really good understanding of one's ACEs and if they have any. So ACEs is a study that was conducted by the U.S. Health Maintenance Organization, Kaiser Permanente, and the CDC. The study conducted in 1995 to 1997, long-term follow-up of health outcomes. So the study demonstrated that an association of ACE, which is a childhood trauma, with health and social problems across the lifespan. Next slide. So ACEs are prolonged and persistent unbuffered exposure to adversity that leads to the toxic stress response and associated with increased levels of risk for poor outcomes. Next slide. Some of the examples and the different types of childhood trauma include physical abuse or physical neglect, sexual abuse, emotional abuse or emotional neglect, exposure to domestic violence. Next slide. Household mental illness, household substance abuse, parental separation and divorce, incarcerated household member. Next slide. So the adverse childhood experiences is a questionnaire. So there's a range of 0 to 10. Of a score of 4 or more, ACEs indicates increased risk of involvement in the criminal justice system, lower income, health conditions, mental or brain health conditions. Next slide. So basically, when one looks at one's ACEs, it connects the dots between adversity and toxic stress, as well as mental health conditions that then manifest in children and continue into adulthood. They can have a negative impact on the following, but not limited to one's brain functioning, the immune system, the endocrine system, as well as can change the DNA. Next slide. So again, this is just a pyramid of just the long-term effects of like, once you have the childhood experiences and adverse experiences, it can impact social, emotional, and cognitive impairment. So we can see the children having difficulty accessing the curriculum, difficulty engaging with their peers, difficulty with regulating their emotions. Then this is prolonged and not mitigated, then you can also have health risk and poor behaviors, which then leads to disease, disability, and then also early death. It's also important to note that, in recent years, we're starting to see a decline in one's lifespan, and the increased stressors that we're experiencing have an impact on that. Next slide. There we go. So COVID-19 pandemic has now been added on to the ACEs. So the COVID-19 pandemic has had an increase in the familial adversity, exposed children to increased familial discord, exposed to parental anxieties and stressors, which include job loss, financial insecurities, food insecurities, housing insecurities. Next slide. Again, the COVID-19 pandemic, what happens is that by amplifying the toxic stress, which is exposure to multiple ACEs, increased family adversity, which impaired children's brain development, particularly during the early years. It has an indirect social and economic impact on the family and may linger for years. Taking all this together, the indirect effects of the pandemic response could exacerbate each of the common ACEs in children's lives. So again, taking this is that the children who already come into the classroom or into our offices with ACEs is exacerbated by the past 2 years of us dealing with the COVID-19 pandemic. Next slide. Okay, so before we move on, those of you, and I can't see who's here, but if anyone who can see the participants, does anyone have the Red Hots or the Fireball?
We stopped the share for a minute. Red Hots.
Does anyone have any Red Hots? Okay, I see a hand there. Red Hots or Fireballs? I'm just trying to see if anyone has it. Maybe we can do a quick.
Yes.
Yes, okay. Those who have that, you can pop the Fireball or the Red Hots into your mouth. I can't see people, but just wait for a few seconds and just kind of get a sense as to what that feels like.
Some funny comments in the chat.
Oh, is it? Okay, I haven't seen. Okay. So holding on to this is just an example of trauma. So some people may be numb to it and may have a high tolerance of the pain or the heat. Some people may react quickly to it, want to spit it out. Some people, may take a while for them to begin to feel the sensation. So this is one example of what trauma is like on one's body and also on the brain. Okay, I can go back to my slides.
All right.
So how has this impacted our children? Our kids have sacrificed in-person school, play dates with their friends, not being able to participate in their sporting activities and not able to travel with their friends and families, and also not able to participate in fun activities like bowling and going to the movies. Next slide. Also, it's important to understand that children are uniquely vulnerable to the effects of an overactive stress response due to the fact that their brains and their bodies are still developing. Next slide. Here are some signs that a child is struggling. Difficulty with affective regulation, so not able to control their emotions, irritability, stomach aches, sleep issues, headaches, and increase in behavioral challenges. Next slide. Signs, some more signs that a child is struggling: increase in the behavioral challenges, regression, new or exacerbated symptoms of anxiety, depression, focus, attention, concentration, and a shift in attachment. Kids may be more clingy or more distant. Next slide. So now we're going to shift. So we talked about the trauma, talk about examples of trauma, and also examples of the ACEs, and also how it's impacted our children. Next, I want to talk about and shift to the impact on the brain, because it's important for us to understand that how our children present to us is having an impact on the brain, and some of this is out of their control. Okay, so thinking about the neurobiology of the stress and trauma, we have the amygdala and cortisol, the hippocampus, and the adrenals. So the amygdala is core and is essential to the neural system of processing fear and threatening stimuli, so threatening situations. So that's at the core of things. So oftentimes we may say someone's brain's on fire, for example, hence the fireball, then that's because it's a response to the stress and to the trauma. So we have to work to kind of cool down their amygdala's reaction to the situation. Cortisol is a stress hormone. We have it in our brains and also gets pumped to our gut. And this curbs the functions of what would be the non-essential or harmful responses in fight, flight situation. The hippocampus plays a major role in learning and memory. So oftentimes we may see that our students and also our clients are having difficulty with accessing the curriculum. It's because it's the overactive impact of the stress and trauma is having on the hippocampus. So they're going to have difficulty learning. We're seeing that some kids are behind academically, but we've been under 2 years of the stress and trauma of COVID on top of whatever else that these kids are already and families are already dealing with. The adrenals, which are sitting right on top of the kidneys, it connects the brain-body connection, and also the vagus nerve, which is the largest cranial nerve that leads from the brain all the way down to your gut. The adrenals produce hormones that help to regulate your metabolism, immune system, blood pressure. It's also responsible for your response to stress and other essential functions. Next slide. So you have two aspects of the nervous system. You have the parasympathetic and the sympathetic. The parasympathetic nervous system is your baseline. It's your homeostasis. It's your calm and relaxation state. You have low blood pressure, baseline heart rate, and we should be here for most of the time. experiencing only short spikes of stress, not prolonged spikes of stress. Next slide, please. The sympathetic nervous system is where you have your fight, flight, or freeze. Please understand that when we're in a stressful situation, we're not able to choose what our response is going to be. The brain takes over and we will either have the fight, flight, or freeze. Next slide. Also under the sympathetic nervous system is like an alarm sent to your brain that something bad is happening or that you're in a stressful state. Modern day stressors can ignite the sympathetic nervous system. You have an increased heart rate and increased blood pressure. Next slide, please. The physical correlates of stress of also being in a prolonged state of the sympathetic nervous system. You have increased inflammation, decrease in immunity, decreased digestion and appetite. So you also may have stomach aches and cramping and bloating, muscle tension, and rapid heart rate. Next slide. Before I go on, are there any questions before I go into what we can do about it? Okay, maybe no questions. Okay.
I see some questions in the chat.
Yes, there's a question that says, do you have to have a specific training to administer the ACE? When is it beneficial to administer to a student? That's one of the questions.
Yes, so you do have to be trained to administer the ACE. It is a questionnaire. And I find it to be helpful, at least in my practice, as part of my initial intake. I think that when you're working with students, when you begin to see some behavioral disruptions or change in their, let's say, emotional state or access to the curriculum, focus, attention, and concentration, to begin to ask those questions to see, what's behind some of these behaviors. It's important to remember that every child's behavior is purposeful. And so it's our job to understand the meaning of that behavior and the function of that behavior. But if we end up missing the boat of what trauma, how trauma might be impacting the child's life, we're going to respond to it differently and not have a holistic approach. So it is important to be mindful of the ACEs and be mindful of what are some of the stressors that's in the child's life so that we can better help support them. Okay, so there's hope. Something's called neuroplasticity, which means that we are not stuck with the brain that we have. There are ways that we can support our children with the modern day stressors, hence the ACEs. Next slide. So Hopkins did a study in 2019 identifying the protective childhood experiences. These are associated with experiences that are connected to improvement in mental or brain health and social connectedness to adults. Next slide, please. As we're engaging with our clients and students, first, what we need to do is analyze our own responses to the current situation. How is it that our manifestation of the stress is impacting the child? It's important to understand that affective regulation is interpersonal. So if we're stressed, our students or our clients can also, or our children could experience the same stress. If we're feeling a little bit uneasy or overwhelmed, it can also be projected onto others. So we have to first be mindful as to check in within ourselves. How am I feeling? Next slide. Here's some examples of some of the protective childhood experiences. Being calm, allowing space for the child to share feelings, being supported by the family and caregivers, feeling that one belongs, feeling safe and protected by adults at home, and feeling as though that two non-parent adults truly care about the child. Next slide, please. Being understanding and sensitive to the child's feelings, asking specifically, what do you feel? Correcting any inaccurate information, feeling supported by friends, participating in community traditions, which has been pretty difficult due to COVID, but as much as the kids able to do so will be helpful. And also using age-appropriate language. Next slide. So it is essential to validate positive and negative feelings. Sometimes we tend to shy away from the feelings that make us feel uncomfortable, but it's important to help the child understand that all of their feelings are important. It's also important to convey the message that it's okay to feel these emotions, whatever that they may be. Next slide, please. It's also important that to not use fear as a motivator. Sometimes we think that using fear to help to curb a behavior or action, it only exacerbates the situation and it makes the anxiety and worry worse. Next slide, please. So one thing we can also help the children do is to focus on what they can control. For example, washing hands and wearing their mask, particularly as it relates to COVID. Next slide, please. So those of you who have balloons, you can take them out. And so I'm going to talk about diaphragmatic breathing. So oftentimes I like to use balloons with the younger children because understanding diaphragmatic breathing can be more of an abstract kind of a exercise. And many of us don't have proper breathing. So we have shallow breathing, but when we do diaphragmatic breathing, you inhale and like poke out your belly like you ate a whole pizza by yourself. You inhale and fill up the chest cavity here. And so you fill it up with air and then you exhale. The exhale has to be longer than the inhale. So for example, it's called 7-11 breaths. So you inhale for 7 seconds and exhale for 11 seconds. That ignites the vagus nerve. The vagus nerve is from the brain all the way down to your gut. So for example, some people may have a racing heart. Again, you're in fight or flight. That's the vagus nerve. Sometimes you're having some difficulty breathing. That's also the vagus nerve that's being ignited. Some people who feel nervous have to go to the restroom. That's also part of the vagus nerve. It's being communicated from the brain down to your body. So again, the brain-body connection. But what helps to calm this down is the diaphragmatic breathing. So if you have the balloons, you can help to calm down the trauma you just had with the red hots or the fireball, and you can just blow up the balloon. And that will help to bring the body from being in the sympathetic nervous system over to the parasympathetic nervous system to bring you back to baseline breathing, normalize the blood pressure, and normalize the heart rate. Okay, any questions?
Dr. Sanders, there was a great question in the chat. I'm talking about whether it's possible or not for individuals to likely respond to stress with the fight mechanism as opposed to the flight or freeze mechanism. And I think that's a great question. Do you want to take that question?
You can go for it.
I like that question. I think it's a smart question. It raises a lot of questions about resiliency for me. That's what came up for me. I think that when we are taught to be resilient and to respond in certain ways, I think that we can go more so toward this fight option as opposed to flight or freeze. I think the natural inclination is when we are feeling stressed, feeling any kind of pressure or pain or difficult emotions, the natural inclination is for us to be in flight mode, right? To run away from it. Sometimes it's easier to address someone else's pain than it is for us to address our own. And so that's why I like this question. I think that we are products of our models. Our framework is really important. How does our framework handle stress, tension, and things of this nature? Do we go toward it? Because the only way over it is through it. Not around it, not backward, not through other people sometimes. And so I think that when we are building resilience, having those stable models that teach us how to get through difficult times, I think it's easier for us to get to that place where we're able to fight through these challenges.
Yeah, but sometimes, so very good point, Dr. Hall. But when we're in a stressful situation, sometimes, we don't get to choose which one we're going to enter. And
Mhm.
so it's important to also know that the fight or flight are both empowering. What's immobilizing is the freeze. And sometimes we may see freeze, for example, some students may dissociate. So that's freezing is also their way of coping. But what is most important to remember is that fight or flight is very empowering because you're removing yourself either from the situation or you're, combating it and trying to deal with it through fighting. So it is an excellent question, but it's definitely something that we've been dealing with long-term stress for far too long, and our bodies are unfortunately becoming too numb to it, actually. Any other questions before I continue? Okay. Okay, so we talked about the 7-11 breaths, inhale for 7, exhale for 11, and then the more that you're kind of doing this repetitively, you're helping to shift your brain and mind and body from the alarm state or the stressful state to the parasympathetic nervous system. So that's diaphragmatic breathing. You have self-soothing techniques. One way to think about this is that you can change the way we think. When you change the way you look at things, the things you look at change. So one powerful way of making this also connect is that if you connect this with your breathing, it leads to better outcome. It's also important to understand that meditation is really important. Studies have shown that 3 minutes of meditation a day for 30 days changes the brain chemistry. Next slide, please. So just to circle back to the ACEs, ACEs is not a life sentence. It is really exposure to ACEs without the intervention. So without positive experiences that leads to increased risk. Next slide. So ACEs with PCEs. Having parents, caregivers, teachers, professionals that listen, care, and show that they want to help is likely one of the best protective factors that children can have. Next slide, please. And that is it. Thank you. Are there any other questions? I went through it pretty quickly to just make sure I got through all the slides. And so we have time for some discussion.
Hello. I have a question.
Go ahead.
Oh, okay, sorry. I didn't know if you heard me. I came in a little bit late because I just got home from work. I just wanted to know what the biggest stresses are for, related to the pandemic, what they are for children. I don't know if you went over that or not.
No, it's okay. It's a good question. It kind of depends on some of the children's dynamics, but what I'm seeing is that social interactions and affective regulations, major things that I'm seeing. Lots of aggressive behaviors in the school setting, difficulty focusing and attending the classroom setting, difficulty at home. Some children have lost loved ones due to the pandemic. Some children have been in homes where there's been a lot of domestic violence and trauma as well. So each child's a little bit different, but in the classroom setting, I'm seeing a huge increase in behavioral challenges and also being able to control their emotions. But, Dr. Hall and Dr. Davis, feel free to chime in.
Yeah, I would even like to add to that. Some of the challenges are academic in nature. So we're used to a traditional classroom where we're in a classroom for 6 hours of a day, and that's 2 years of loss of in-person classroom for many of us. So a lot of students are readjusting to be in a classroom, which may play out to them having difficulties behaviorally, as well as if students are being assessed and being evaluated, it could appear as though they are further behind than they actually are, just due to the nature of in-person learning versus virtual learning look a lot different. And then we look at, especially in the primary years, when children start to learn how to interact with other people and other students, they've lost 2 years of that time. So they're not building relationships. There could be some challenges around language acquisition. So those are just some of the issues that they may be experiencing as in the school, as well as we had to consider what their home lives may be like. You could have parents who may have lost jobs, may not be able to, afford some of the essential things that are at home. And like Dr. Sanders said, they may have lost loved ones, and they also could have been had their own experiences with COVID personally. So some of these are just a few of the things that maybe these students are experiencing, as well as we have to consider the staff, the teachers, the people who they're interacting with on their daily life as well, their experiences of COVID and how those experiences of COVID are now playing into the classroom and impacting the students as well.
There's also more information coming out about COVID and the impact on the brain. So I'm attending a workshop tomorrow about infectious diseases and brain functioning. So, aside from loss of smell and taste, the COVID is definitely having an impact on brain functioning. So because we're 2 years just into the pandemic, the long-term effects, we haven't had all the research yet, but I will be getting more information starting tomorrow about how infectious diseases are impacting brain functioning. So there's definitely more to come. But, I think that there's a question in here about if there's ages or band or grade bands where I'm seeing more affected than others. I think it's across the developmental span. Here in Maryland, we're seeing uptick in violence in high schools, like guns and stabbing. So that's increased at the high school level and middle school level. In elementary schools, from kindergarten up to 5th grade, kids are just way more aggressive and having difficulty in being able to engage with their peers, how to communicate with one another. And then also the other piece of being able to access the curriculum. And so trying to understand also what's their family dynamic, what's happening at home. So it's multi-layered, and trying to figure out like, where's the needle in the haystack and where's the source of it. It's just going to take some time. And so the kids are just now, I guess, hopefully having a full school year of being in the classroom, but this is just the tip of the iceberg as to what's the full ramifications of COVID on these children.
I have a question. Dr. Reed Barnett. Thank you, Dr. Sanders, Dr. Hall, and Dr. Davis for doing this for NISCA. As a school counselor, what should we be looking at in terms of our students? Do we ask questions like to the parent, like, what has happened, what has happened during COVID time? Do you see the behavior of your child, changing? And in terms of recommendation, would you recommend the parent letting the child or having a psychologist to find out, what's going on with the child before, let's put them in special education? Does that make sense? What I'm asking, right? How do we as school counselors or clinicians, before the child gets to special education because of COVID, or there's certain questions that we need to ask the parent, and I guess that's my question. I got a lot up here in my brain, but.
Yeah, it's a good question because as Dr. Davis had kind of mentioned this as well. I think that we have to be careful to not over pathologize these kids and to overly diagnose these kids because they may present as being, more behind academically or cognitively, but because of the stressors are impacting them to be able to perform at their highest potential. So I think that, if able to ask questions about what's been the impact of COVID on that individual child, what's happening in the home, have you seen a change in their eating habits and their sleep habits is going to be really important. Has there been any significant changes in the household? It's going to be really important. And to see if there can be other mitigating factors put in place before placing the label onto these children. Because once you get it, take some time to kind of remove it. But I just don't, we're having the same trouble as far as how do we properly diagnose and assess these kids who may not have otherwise presented with these complaints or these symptoms. But
Thank you.
I think ACEs is a really good way to start too, because it helps you understand the whole family constellation.
Mhm. I agree with that. And the only thing I was going to add, and we talked a little bit about it earlier, was that one of the things that I've been noticing is kind of an uptick in pretty heavy duty diagnoses. Similar to physical health, mental health, with mental health, there's a lot of overlap. And so you have to be very careful diagnostically and make sure you are asking those questions. One of the things that was mentioned before about behavior that we're seeing, and someone asked in the chat as well about witnessing these aggressive behaviors from children. Sometimes families aren't recognizing trauma and what trauma is. I have so many people that indicate that certain things, that their child was not traumatized, but then when you do a thorough interview and background check and things of that nature, you hear all of these things. Depending on area, location, people are easily becoming desensitized to death and other types of things that are happening. And for them, it's just a normal part of life and a normal part of functioning. And they're not characterizing that, even though trauma lives in our body. So even though we're not registering it as a trauma, our body is registering it as a trauma. And we're not noticing or understanding that duality or that what that experience is like for a child. So just having that thorough background and understanding what that child has gone through would be helpful.
And great. I think that's important. I think that Dr. Hall bringing up the point about how the body responds to trauma, I think that is so important. And, asking parents more questions or guardians more questions about how the child has responded. And what you can always do? The simple thing is you can talk to the kids, talk to the students and ask them how they're responding. And they're going to tell you how they feel. They're going to say that they hate it. Being quarantined, that they're over it. They just want to hang out with their friends. They're tired of the parents. So, some of these things are just normalized things. And so I think that's the important thing is talking to your students, asking them questions. And when you see them in the mornings or see them in the afternoons and they may look like a little off, just check in with them. Ask them, how are they doing? Because that may be something that they're not getting at home. So just checking in with them would be a first step. And that could be open up the doors for them to be able to discuss what's going on with them.
Oh, Ray had his hand off. Ray Polk.
Yes, thank you. One of the things I heard you mention about the meditation, 3 minutes of meditation over a period of time. So it almost seems like teaching those breathing, the things that we were doing before, the breathing techniques, the meditation, and not really focusing on how many ACEs the students have, but across the board, I think that would benefit everyone. Am I correct in that?
Well, absolutely. So meditation can benefit everybody. And I think that because now COVID is considered an ACE, we all have at least one ACE now, right? And so I think that it can be safe to say, assume everyone has an ACE or at least more than one. So if you just meditate 3 minutes a day, it will be helpful. So if that means as your students are coming in and just have a quiet moment, give them some time and space, just kind of be still, that will be helpful. So yes, 3 minutes a day changes the brain chemistry. Absolutely.
Yeah, because I'm thinking that that's something that we might, like I'm thinking in my particular school, in the advisory period, 3 minutes out of 10, and we may be able to solve a lot of conflict.
Yes, but some people may have, multiple ACEs that's going to kind of definitely impact their ability to kind of move forward, and we do want to be careful that, if you think about the layers of an onion, there's multiple layers of an onion. We're trying to get to the core. It may take a lot of time to get there. We try to put our kids back together before we send them back to class or back home. So it's going to take some time. So, doing some of the belly breaths or having the kids blow a balloon a couple of times is going to definitely allow them to be able to focus. So what happens is that when we're stressed, we're not in our frontal lobe. Your frontal lobe is where you're having your focus, attention, and concentration. When we're stressed, we're in the animalistic part of the brain, the limbic section. So what happens is that they can't engage and have a conversation. They're not going to be able to learn and to have any memory. So when you're doing the belly breaths, you bring back the frontal lobe back online. Then they can talk about what's going on, what's made them upset, why they're in this conflict with this other classmate, or why they're having some difficulty attending to the teacher. So, there's multiple aspects with the belly breaths and also the meditation, which you can then bring the frontal lobe back online and be able to have, a reciprocal conversation with that student. So just know that when our kids are on 10, we can't expect them to have a conversation. They can't do it. The brain's just not wired that way. So we have to let them to put something else in place so that then they can have that conversation and to be able to problem solve. So there are
Thank
lots.
you.
Sure. There are lots of questions. The chat kind of moved pretty quickly, so there are lots of questions, good ones that came through here.
So I'm going to try to tackle the
Okay.
question about true learning disability.
Oh,
So
I was actually going to direct that one to you, Dr. Davis.
Okay.
Thank
So
you.
this is such a difficult question, and we always go back and forth about trying to decide whether or not the student actually meets the criteria for a specific learning disability. So a couple of things that we can do, because we also don't want to under-identify. So we may want to consider when we're administering assessments is look at a student's scores prior to any type of assessments, right? So we'll look at the performance 2 years ago, and they were potentially performing on level and they were doing well. It's more than likely not a specific learning disability. It could be better explained by lack of instruction in the classroom, all these other different factors. So those are things that we can look at. The other thing that we could possibly look at is that we could also look at a student and possibly look at the other students within the classroom, right? So if we have a student, if 50% of the students are performing 2 years below their grade level or 2 standard deviations below, the mean, then that is something for us to consider whether or not that student specifically has a specific learning disability, or is it better explained by the pandemic, lack of instruction, and so forth and so on. So one of the most important things that I always explain to families, schools, is that the achievement tests do not account for 2 years of lost in-person instructional time. And there is a difference between virtual learning versus in-person learning. So these are all things that we have to consider when we are identifying and assessing and diagnosing our students that we work with.
So there's a couple things in here that's important. Someone made a comment about the educators in schools can be a source of trauma as well. And that sometimes it's the mindset of let's just get back to business. And so absolutely. And so this is completely dismissing the elephant that's in the room. We can't just get back to business. We're not the same people that we were 2 years ago. Lifestyles have changed exponentially, and our kids have suffered. And so, it's a systemic issue at this point though, right? I mean, so if everyone's saying, let's get back to business, get back into the classrooms, everyone's doing their standardized testings as if that things are normal and that these kids haven't had 2 years of unusual learning, it's going to definitely be difficult. And I think that it's a misconception to think that we can just get back to business. It's very problematic. And some also made a point that helping to expand our kids' emotional vocabulary. One thing that can be done with the younger kids is that if you want to draw like the shape of a gingerbread, and if you have like some Band-Aids or something that's like, you can kind of have them like point where on the body does it hurt, or where on the body is having some difficulty. And then you can begin to attach some language to that to help to expand their vocabulary. That's for the younger kids. The older ones, you're right. They just say, okay, I'm good. And just kind of give some of these, just kind of blanket responses just to kind of move on. That might be a coping mechanism that they haven't learned how to engage and how to even identify and label their feelings. So that's where we come in as clinicians to be able to help to expand that language. And it's our relationship with our patients and our students and our clients that help to build that safe space and to help to build that comfort to be able to have such a vulnerable conversation. So, you guys play a significant role in your students' lives, and probably providing an environment for them to be able to communicate in ways that they may not otherwise be able to do so. Was there anything else that you guys saw that wanted to answer?
No,
It
just
went by so fast.
the same thing that you were talking about, relationship. I always tell people that we were created for community. We weren't created to operate in silos. And it's, you talked about it being a systemic issue. I mean, it's just the way of our culture. America is back to business as usual, right? And so we have to possibly individually create space in our classrooms, in our homes, where we are building relationship and we are separating ourselves from the back to business mentality, teaching people how to communicate differently. And it starts with listening actively and not inserting ourselves and allowing people to express themselves, teaching them how to do that, being kind, reassuring them and not shutting down their emotions when they're talking about them. It starts with those things. And Dr. Davis mentioned that earlier, giving that extra love and that extra attention. How can we just as a whole restructure the curriculum as long as we're getting to the meat of the crux of what we're supposed to be getting to? Is it robbery to have a second 5 minutes, 7 minutes to, have a mindfulness session with our students in class every day? No, it really isn't. Can that be weaved in? Those types of things. So thinking about how we can reestablish a connection and a relationship with people in a different way, and create these spaces where we are modeling how to communicate, how to build our emotion vocabulary and all of those great things.
And that's important. One thing that I'm hearing here is that, this whole back to business expectations. Many of the students can't do that. Many of the students are anxious. They're concerned about getting COVID. So if our students are anxious, then they can't access the curriculum. If they're too busy worried about what's happening at home, or, are they afraid that they might get COVID and get sick, particularly if they're aware of someone else has had the virus and is not doing so well, then they can't access the curriculum. And so I think that we're so far away from getting back to business. I would agree, if you can incorporate belly breaths or mindfulness or deep breathing or meditation into the curriculum, into the day, then we might be able to get back to business. Then you may be able to see an increase in a bump in academic performance in your standardized tests. But if we don't create some space and time for our kids to really be still and to let the brain heal, we're not going to ever really be able to get back to business and to get back to where we were pre-pandemic. We're a long way away from that.
And I do want to circle back to a statement that was made earlier, within the chat, as a reference to outbursts and aggression and other students essentially being traumatized by that. I think that putting that 3 minutes in the classroom in the day could be helpful for a regulation of the student who that may become dysregulated, and also helpful for the students who may be feeling anxiety or being anxious due to, there are these students in the classroom that are having some, challenges, social emotionally. So I think those are ways that we can to integrate that as well. So I know that we're speaking about COVID, but also there are a lot of social cultural things that are going on as well. So we're combining these things together. And this, like Dr. Sanders and Dr. Hall both had said, like we and everyone else in the chat, we aren't going back to business as usual. It's just not possible at this time. And I would encourage, the teachers to, speak with their administrators to be able to encourage them about, trying to look at it from a different lens. And data is not going to be the only key, the criteria. Like Dr. Sanders said, if you're not able to access those things from, executive functioning and your frontal lobe due to everything that's going on, the data is not going to reflect that. No matter how great the teacher is, that's not going to be reflected in the data.
And I think, quite frankly, do we want to get back to business anyway? I think that going backwards is not the way that we want to go anyway. Let's not go back and do those things. Maybe we should learn from what our experiences and how can we be better than we were 2 years ago? Because I think going back to business is not healthy either. And I think that doesn't mean that was the right way to do things at the time. I think that we need to take things a little bit slower to be more mindful as to how the brain's functioning, how the brain and the body have a bidirectionality and has an impact on one's functioning and presentation, and seeing these kids differently, being mindful that they are not their behavior. The behavior is a symptom and a presentation that something else is going on. So if we understand from that perspective, then we can probably be able to kind of help them as much as we can.
Couple minutes left.
Okay.
Again, I just want to say you guys were fantastic. I can
Thank
see
you.
I can see a part 2 coming forward. I believe Dr. Sanders, you said you're going to a workshop tomorrow.
Tomorrow for 3 days.
Okay, so we would love to know what that workshop is all about. Dr. Davis, thank you for your insight. Dr. Hill, thank you for your insight. In addition to my many titles, I'm also the Professional Development Chair for the New York State School Council Association. And these are our members. Dr. Wally is our past president, Dr. Corvitt, Dr. Vertonda, Lisa Mesa, and Cheryl Hall. Again, I want to thank you. We also have a couple of workshops in the future. As a matter of fact, we have one on February 10th. So counselors, if you're able to attend, we encourage you to attend our workshops. We've been doing these workshops for the past 3 years, and we've been doing a lot since COVID-19 has come upon us to educate, to let our counselors know that, yeah, you know, the kids need you. I mean, this is your work. Dr. Sanders, again, I mean, your work is fantastic. It's something that I didn't know about. I mean, I know part of the brain and we talk about different parts, but I didn't realize how COVID has affected, you know, younger children. And again, as you also spoke about the violence, I mean, you have violence where you are and so are we. And we have to work together to get our kids to understand that, you know, it's not your fault, that this is what we have to, you have to do this in order to do that, if that makes sense. You know, what's happening today is not your fault. And teachers and counselors, we just have to be mindful of our students that we're dealing with. Every child that acts out and screams out, it may not necessarily have to be placed in special education. We need to do other things to help them as well. And I truly believe we need to educate our parents as well to let them know that because your child needs a psychologist is not taboo.
Yes.
Especially in the African-American race, you know, it's like taboo. But we have to, counselors, we have to instill in our parents when we do those parents workshops to let them know, you know, counseling may be another way that we can look at your child in terms of achieving. So it's not taboo. Again, thank you very much. Bob, who keeps me sane, he's our executive director. Bob, anything you want to say?
Just thank you, Gail, and thank you, Dr. Sanders, Dr. Hall, and Dr. Davis. Very informative. I see a couple of my students on here too.
Oh, okay. So,
thank you for
Mercy
having
students. Where are my Mercy students?
Yeah, Dr. Sanders, sometimes participants ask if they can contact the presenters. Would that be okay?
Yes. You want us to put it in the chat?
Yes, that'd be good.
Mm-hmm.
Because one of the things I do when I send out the recording and the PowerPoint is I send the chats out too, because there's a lot of good information.
Mm-hmm. And cool. They're on our website as well, on NYSCA.org.
Not quite yet.
Oh, well, it'll be there. I heard we on YouTube as well.
Oh yeah, we're on YouTube. We got a YouTube channel.
Okay, I have to be careful what I say. Again, thank you so much.
And thank you for having us. It was such a pleasure. It was, you know, really enjoyed participating with you and your team and everyone up in New York. It was definitely a pleasure. So thank you for having us.
And real quick, Dr. Sanders, I want to tell Dr. Cook, I thank her very much for introducing us. Yes. I believe her mom is on here somewhere. I saw a cook on here.
Okay,
So,
okay.
So a shout out to Dr. Cook is another friend of mine. She's doing surgery. That's what mom said. So I just want to give a shout out to her mom. She's on here as well. I saw a little earlier. So thank
Okay.
you.
Thanks
Thank you.
again.
Have a good evening, all.
Thanks,
Yes,
you
have a
too.
good evening.
Bye.
Bye.